It is okay to go. Right, there we are. Right, it's being live. Got it. Right, okay. Right. Welcome to the most recent meeting of the Scrutiny Board, Environment, Housing and Communities. I'll go through the introductions and various other things in a minute, but because this is going to be a remote consultative meeting, I've got something I need to read out to any members of the public who are coming in. This is a remote consultative meeting of the Environment, Housing and Communities Board. The public section of the meeting will be webcast via YouTube and is accessible by following the links on the meeting page. This remote session has been arranged to allow members to discuss the approach in Leeds to reducing gambling harm. For the purposes of information and transparency, last year, a High Court ruling clarified that as of the 7th of May 2021, local authorities are required to conduct physical meetings to take formal decisions. Under this consultative arrangement, we will therefore not legally be able to take formal decisions, and the consultative status means that some of the usual formalities will not take place at the start of the meeting. Should any decisions be proposed that require formal ratification, such as recommendations to the Executive Board or those relating specifically to statutory functions, those will be referred for formal approval at the next physical public meeting of the board on the 2nd of February. So that said, can I ask any members to disclose any interests that they would like registered? I see none. Okay. So the only apologies I've received is from Councillor Smith. Has anybody of any other group received any apologies from any of their colleagues that we need to formally record? No. Okay, that's fine. So I'll now ask the scrutiny members to introduce themselves, and then I'll get the officers and the guests to introduce themselves as well. So, Councillor Akhtar. He has got problems with his connection, so we'll come back to him.
Hi, Javid Akhtar, Little London and Woodhouse.
That's fine. Councillor Finnegan's not in the call. Councillor Maloney.
Morning, everyone. Councillor Annie Maloney, Beeston and Holbeck Ward.
Councillor Tudor.
Good morning, Councillor John Tudor, Killingbeck and Seacroft Ward.
Councillor Brooks.
Good morning, Councillor Brooks, Little London and Woodhouse Ward.
Councillor Graham.
Morning, everybody. Councillor Pauline Graham, Crossgates and Winmore Ward.
Councillor Wadsworth doesn't appear to be in at the moment either. Councillor Carlisle doesn't appear to be in either. Councillor Khan.
Well, hi, good morning, everyone. Councillor Asghar Khan from Bermatoff and Richmond Hill Ward.
And Councillor Lay.
Morning, everyone. Councillor Sandy Lay, Otley and Yeadon Ward.
And making her debut today, Councillor Thompson.
Good morning. Thank you. Councillor Eleanor Thompson, Guiseley and Rawdon Ward.
And welcome, Eleanor, to
thank you very much.
This fun and games that is scrutiny.
Thank you.
Right. Becky.
Hi, Becky Atherton, Principal Scrutiny Advisor.
Cash.
Hey everyone, Natasha Prosser, Clark.
Councillor Harland.
Hi, Councillor Mary Harland, Kibbleton Methley Ward and Cabinet Member for Communities.
Councillor Marshall Katung.
Good morning.
Morning. Morning.
Okay, right. Apologies, thank you.
It's okay. Now, in terms of the officers, Sue Duckworth, who is the Principal Licensing Officer.
Good morning, everybody.
Myrta's not coming. Grace Lawrence, who is a Senior Policy Development Officer.
Morning, everyone.
And Nicola Raper, Section Head of Communities, Housing and Environment.
Morning, everybody.
Now, and then our guest from NHS Northern Gambling Service, Matt Gaskell.
Good morning, everyone.
Now, have I missed anybody out unintentionally? I can assure you. I think I've managed to get everybody good. Okay, all right. So everybody's in. So what I'd like to do now is I want to invite Sue Duckworth to bring out the highlights of the report, and then I'll get Matt Gaskell to talk to us for about 5 minutes, outlining what his service does, and then we'll open it to questions and debate. So Sue, over to you.
Thank you, Chair. This report presents the Council response to the document issued jointly by the Centre of Governance and Scrutiny and the Gambling Commission entitled 10 Questions to Ask If You're Scrutinising Gambling Harm. And we put that as Appendix 1 to the report. We've addressed these 10 questions in the Reducing Gambling Harms briefing note, which we've attached as Appendix 2 to the report. So before I very briefly discuss that, and before we move on to answer any questions on the briefing note, I just wanted to briefly provide some context on the regulation of gambling. So it seems obvious that the best way of reducing gambling harms would be to reduce or at least halt the licensing of gambling premises. And that's why entertainment licensing is here. And over the years, this has been our first port of call. However, the regulation of gambling is complicated and it's split between the local authority and the Gambling Commission. The Gambling Commission is the national regulator and it's responsible for regulating gambling operators. And this includes those that operate physical betting premises, such as betting shops, and those that provide online gambling via websites, apps, phones, and so on. They also regulate the National Lottery and scratch cards. They determine what social responsibility measures should be taken by operators. They determine the gaming machine technical standards and even what constitutes something like bingo. They provide guidance and support to local authorities. So what does the council do? So we only regulate the physical bricks and mortar premises. And we're restricted on how we do that by the Gambling Act, which is a permissive regime. The ability to refuse a gambling application is severely restricted. And the most we can do realistically is to apply a range of conditions. So this is the approach that we now take in partnership with our communities to ensure that any licensed premises does not negatively impact on the locality in which it sits. It works. We've applied a condition to an adult gaming centre in Hare Hills. That's led to some great interaction between that premises and treatment services and has led to a number of referrals. However, I must advise the number of applications the authority is asked to consider each year is very small. We only get one, maybe two, and in some years we don't receive any applications whatsoever. Over the past few years, we've seen the number of betting premises decline. And as Leeds itself is the third largest licensing authority, you can see that local government's sphere of influence is very small. However, this is Leeds, and this does not stop us from being a proactive and innovative authority. We commissioned research into gambling harms, and from there we were able to demonstrate the need for more treatment services in Leeds. We've worked in partnership with other organisations and across the whole council to make a real and tangible difference to those suffering from gambling harm. We continue to do so through our multi-agency partnership approach, and we work alongside organisations which address poverty and financial hardship, provide treatment services, offer support and advice to the residents of Leeds. We've provided a marketing and communication campaign called Beat the Odds to advertise the available support. And we've provided training for frontline staff to identify and support those suffering from gambling harm. And that's not just our frontline staff, that's frontline staff across the city. We've delivered training and communication around children and young people's gambling and gaming. And as one of the area's largest employers, we've developed internal guidance for our own staff around gambling harms with the ambition that this could then be rolled out to other companies in Leeds. Having had a difficult couple of years, we're now reinvigorated and are reigniting our links with other agencies and organisations to further support our communities. So now I'd like to hand over to consultant psychologist Matthew Gaskell, who is the clinical lead at the NHS Northern Gambling Service. We'd like to tell you about their clinic, which is working directly with people suffering from gambling harms. Thanks, Matt.
Thanks, Sue.
Okay. Matt.
Again, good morning, everyone. I'm very pleased to be here to tell you a little bit about the NHS Northern Gambling Service. We're very pleased to be hosted by the local authority with our location at Merrion House, where we're embedded with the relevant stakeholders and in a good partnership. And Leeds is one of the cities in the country which is well known for its response to gambling related harm. So our service opened in September 2019. We're commissioned by NHS England as part of the NHS long-term plan. It's important to note that our service covers the north of England. So we cover Yorkshire and the Humber. We also cover the northeast, and we also cover the northwest of England. However, we're often known as the Leeds Clinic. This is our main hub, and we're proud that Leeds is given such a spotlight with regards to the way in which we're seen as a national centre of excellence for treatment. So we have other regional clinics in Manchester and Sunderland, and there are plans underway to double the number of northern clinics by the end of next year. We could see that as a positive on the one hand, in which we're able to obviously meet the needs of those suffering from gambling harm, but it's also a reflection on this being a significant public health problem. We have a specialist multidisciplinary workforce made up of psychologists, psychotherapists, doctors, mental health nurses, and importantly, people with lived experience. We're a highly trained workforce, highly skilled, well supported, and we offer evidence-based individual, group, and mutual peer support for those suffering with gambling harm, but also importantly for affected others and loved ones. So it's important to note, we often focus on the individual gambler, but for every person with suffering gambling related harm, there are a number of other people affected. So who do we see? Without going into too much detail, effectively we see people with the diagnosis of gambling disorder, or in lay terms, a gambling addiction. So people with significant gambling harm, as well as I say, those who are affected by a loved one's gambling. The person suffering from gambling related harm doesn't need to be in treatment for a loved one to access the service. So loved ones do access the service, even if their loved one is continuing to engage in significant gambling harm. We also treat co-occurring mental health difficulties as well, which often co-occur with gambling addiction. So our specialists are able not only to work on the gambling, but also to work on the other difficulties that come with them and offer a holistic care package. We receive 500 to 600 referrals a year. Half of those are direct self-referrals, and the other half come from stakeholders and other professionals. So I'll tell you a little bit about the population, what we've learned so far. 70% are male, like 30% female. The most common age group, 58%, are between the age of 20 and 39. The most common types of gambling activities that they're engaging in are gambling machines, slot machines to you and I, sports betting, particularly in-play sports betting, which is a continuous form of gambling, and scratch cards. It's these continuous forms of gambling which are known to be the #1 predictor of gambling problems. So the more traditional discontinuous forms of gambling, where you're gambling on a future event, carries less risk than those activities that the individual's engaging with in the action, if you like, and betting at higher frequency. The length of gambling is 14 years, so there are implications there for early identification and prevention. Treatment is not really the _1 response to gambling related harm. We do need to get further upstream, and when we see the length that people have been gambling at such significant levels, the distress that they're in when they come to us, the way that most of the domains of their life have collapsed around them by the time they come to us, we do need to take collective responsibility to move this further upstream and not see treatment clinics as the answer. The average debt of our service users is £20,000. There are implications there, obviously, for the national legislation and regulation in terms of affordability checks, which are being discussed at the moment. The core pathway are what we call ecological factors. So it's clear to us that it's the convenience and the access and the acceptability and normalization of gambling, which are the key risk factors. In terms of outcomes, 80% of our service users are abstinent after their treatment, and 75% of those are abstinent at 12 months follow-up. Their mental health and social functioning has also dramatically improved. I think for us, there are issues around prevention and earlier identification, embedding gambling harm across the ecosystem of the city to enable harms to be better identified and for signposting to happen. And as I said earlier, this is really about taking a comprehensive public health approach and preventing the harm before it gets to the state that we see every day in our clinic. So that's all from me for now. I'll be happy to take questions.
Right, thanks very much for that. Now, in terms of the best way of dealing with this, it's such a wide-ranging paper we've got here, and some of the questions are interrelated. So I'm quite happy if we don't necessarily have to go through things in order. So does anybody want to ask the first question? Anybody got any? You can either signal by putting your hand up physically or metaphorically. Councillor Khan.
Yeah, thank you, Chair, and thank you, Sue, for the presentation, and Matt. Just want to echo what Sue said, especially the ward I represent, Bermatoff and Richmond Hill and part of Hare Hills. And we worked very, very closely with Sue on licensing. And yes, we could not stop the gambling premises getting the license, but however, we put so much conditions on it. And then also we're monitoring that premises, and it has worked really well. And it's gone, working in a partnership has, worked well. But where I'm had a bit question mark is the public health, actually. Public health, for some reason, do not comment on some licensing premises. I think they need to be more proactive. Such as, the other West Yorkshire Police does a fantastic job as well with us, Leeds City Council, but public health, I think, needs to be more proactive with us. Thank you, Chair.
Thank you. But before I get the officer, Sue, to come in, Councillor Marshall Katung, has your scrutiny board through the public health ever discussed the gambling side of things, or is this something that after today you will be taking to your board?
Yeah, you're right. We haven't discussed this. It's not on our schedule for the municipal year, but definitely based on what I have heard this morning, is something I could take back to our scrutiny board.
That's fine, thank you. Right, Sue.
Okay, so with regards to public health, our lead on gambling in public health is Myrta Elbers, and she was due to be here today, but unfortunately has had a family emergency. So I'm sure she won't mind if I speak for her briefly. Public health and licensing, we have a really good, really strong relationship. they have helped develop a risk tool that we use in alcohol licensing, but we do also use it when we make our representations as a licensing authority for gambling premises as well. And it provides an overview of the issues that are in the area. So for the application in Hare Hills, which was the adult gaming centre that we applied all the conditions to, I was able to use that risk tool to describe the issues from a public health standpoint of what was happening in the area. And it was on the basis of that evidence that we were able to apply so many conditions. So they are involved on an application side, but I have to say, as I've already said, we get so few applications a year. Our influence really through licensing is actually quite small.
Okay, thank you. Do you want to come back, Councillor Khan?
Yeah, Chair, just briefly, thank you, Sue, for that assurance. And can I just take the opportunity on behalf of my colleagues and my neighbouring colleagues to say thank you. You put a lot of effort on that licensing, and we made sure we had the right conditions, and so people are getting help from that premises. And if that model can be used other areas, I think it can work really well. Thank you, and pass my regards to all the officers. Thank you.
Thank you. Right, I've got Councillor Brooks, then Councillor Lay. So Councillor Brooks first, please.
Thank you, Chair. Scratch cards was mentioned as a higher risk activity. Do we have connections with supermarkets, local shops and any other retail outlets that sells scratch cards to help support those at risk of increased gambling harm?
Which of the officers wants to try and take that one? Yeah, Grace.
So within sort of our partnership, we've got another treatment service, so Leeds Community Gambling Service, which is part of GamCare, who have a training and engagement team. So that engagement team, I know, has undertaken some work with supermarkets. They cover the whole city, so they don't have partnerships with all supermarkets, but I know that in particular they've done some work with in Hare Hills, on Hare Hills Lane, for example, where obviously we know that there are a number of betting shops within a very small kind of geographical area, and that they've also undertaken some engagement work in the supermarkets. I think it's something that more could be done on, especially if there are areas, that members, for example, have concerns, and I'd be happy to personally pass that on to the team. As I mentioned, there are two officers that cover the whole of the city, but they are keen to get any leads on businesses where they could do some proactive work. And then I suppose it's probably back to Sue on the licensing arrangements, because we don't have any power locally on the control of scratch cards. It's overseen by the Gambling Commission. But in terms of that engagement work, there's definitely things that we can do through our community partners.
Okay, Councillor Brooks, do you want to come back again?
Yeah, thank you, Chair. It seems to me that it's incredibly cruel in the case of scratch cards that they are available to buy at a place where you'd go to get basic supplies for life. So like people being put in that situation every time they need to pick up essentials. I think that's, I think it's really important that we do reach out to supermarkets and other like corner shops and other places that might sell them, just to try. I know that we can't ban it, we don't have the power to ban it, but like just to try and reduce that harm, and to put in place some I don't know, like, I mean, how many supermarkets and how many shops are we currently working in partnership with? Like, where are the areas where there isn't any contact in the city?
Grace?
So I don't have those numbers to hand, but I can get them for you from Leeds Community Gambling Service. But what I can say is Leeds Community Gambling Service have worked very closely with an officer in the communities team called Peter Mudge, who works on sort of local centres programmes and local high street partnerships. So I introduced him, I think it was in response to the Mercur Slots application, actually. So they are working together, and where there are kind of areas of concern, they will respond. And I know that they've tried to attend some of those partnership meetings, but clearly that's not the whole of the city. So what I'll do is I'll take that away, and I'll get the numbers of supermarkets that are being worked with, an indication of those that aren't, which I'm sure will be many in the reality. But I'll share that and bring that back.
Before bringing Councillor Lay in, any concerns that we have as a scrutiny board or as councillors in general, how do we get our concerns escalated up? Is it, do we all contact Councillor Harland and then she can write on behalf of the council? Or is there anything that Councillor Harland and I can do together to write to anybody raising concerns? How do we raise the concerns that are being expressed today that are not within the council's control? What's the mechanism for us as a local authority to bring concerns up? Sue?
We would probably need to go through our normal lobbying groups,
right,
or routes. We could certainly write to the Gambling Commission, especially things around scratch cards. If you have a specific concern around scratch cards, we could write as a council to the Gambling Commission. We've got contact details and so on.
That's fine. That's fine.
But I think it would be through our normal lobbying routes.
What I want to do is give confidence to members that they can talk about, gambling in general, and we will try and find a mechanism of raising their concerns, because we've got a narrow focus discussion today, quite correctly, but I don't want to hold back any debates or any concerns that elected members have. And then what I'm saying is it's effectively up to Councillor Harland and I to get together and work and to come up with a way forward if we hear members' concerns today. So that's where I'm coming from on that. So that's fine. Councillor Lay.
Thank you, Chair. Couple of comments really, and then a question really to our subject matter expert in Matt. I think for me, a couple of things that concern me. I think betting shops will go the way of banks as more and more betting goes online and goes behind closed doors. And I think as a nation, not just as a council, but we need to start to consider how we're going to regulate online betting. The other thing that has concerned me for a number of years is that tobacco was taken out of sport. Tobacco sponsoring was taken out of sport, and it's been replaced by something that's equally as harmful as in sports betting. So you cannot watch any sport without seeing shirts of football teams or hoardings or adverts in between any games, or even programs being sponsored by Sky Bet or any of the others. I think we need to do more as a country in containing the growth of gambling, and I think the liberalisation of gambling in 2006 has been harmful to this country, I would suggest. And has Matt gone?
No, he's up. He's still on the screen.
Oh, it's just moved on my screen. He's gone to the top. Matt, I just wondered, for my benefit, I'm not an expert on gambling or anything, and addiction, but as our expert on addiction, if you had a magic ball and there was one thing or a couple of things that you could do or could ask of your local or national politicians to lobby for, what would it be?
Matt?
Thank you. Well, as has been expressed, much of this is national policy. Locally, the things that can be done, obviously Sue is the licensing expert and she'll speak to that. It is, more than a little depressing to hear how little one can do to reject these applications, I have to say. These premises tend to be in more deprived communities. The industry tend to want to place gambling premises where they're full of gambling machines, which are the number one activity associated with harm internationally. Advertising, though, is something that we can do locally. My understanding is that Bristol is the first city in the country which is free of gambling advertising in terms of what their local authority is able to do. I'm not sure where we're sitting on that in Leeds, but we have powers to prohibit gambling advertising in our local spaces, and I would certainly promote that idea, because it's the, as you say, it's the normalisation and it's the ubiquitous nature of this promotion, and stimulating a market is deeply harmful. So I think there are things that we can do locally. In terms of the online gambling, you're quite right. Gambling is transforming. It's moving away from traditional venues more and more online. The laws are way behind the laws with land-based gambling, although you may be aware that there is a government paper due for publication in the coming weeks. We think February is the most likely publication for that, and it will probably largely focus on online gambling. So we're waiting obviously to see the outcome of that. My understanding is that the government are less persuaded by significant advertising restrictions, perhaps seeing some of that with the obesity agenda and other health behaviours. So we're waiting to see that. But you're quite right. I think one of the things that is being is going to happen is certainly the Premier League are voting on a voluntary basis to prohibit gambling sponsorship across shirts. Now, of course, that only takes us so far, because if you are a follower of sport, you'll see the advertising around the perimeter of sports stadiums and elsewhere, which is very problematic. But at least it sets a precedent, and that would be potentially a start. But obviously, it would be better if the government legislated.
Okay, thank you.
Yeah.
Sue, so would that be possible then to follow what Bristol's done? So around the corner from me, there's a large digital signage on Bradford Road, for example. I don't know if it advertises sport gambling, to be honest, but do we have it within our powers to stop gambling adverts on privately owned private land, etc.? So this digital sign, which sits on, actually it probably sits on the highway, do we have licensing powers to stop advertising in our city?
Not as far as I'm aware of, but if I can pass over to Grace, she is far more the expert in this than I am.
Because Grace, Bristol's done something, haven't they? What have they done?
Yes. I'm not aware of the detail of what Bristol have done, but we have, as a local authority, we on any of our kind of basically as a council, we do not promote any obviously do not promote gambling, nor do we allow the promotion of gambling on any of our sort of avenues, like, for example, like the Armley billboards we own. And then in terms of the sort of private advertising, it's obviously a much more challenging area, but my colleague Myrta from Public Health, I'm aware that she's picking this up as a key piece of work across both gambling and alcohol. So I can get a bit more detail on that from her. I know, for example, there's a company called Clear Channel which advertise on like pub screens, and I know that we were, as part of the Beat the Odds campaign, we're looking to make use of those, and I know that many gambling companies during the World Cup, that was, they obviously have a huge budget for advertising, especially around sports tournaments, and those screens were full of those advertising. So it would be really interesting to see what more could be done. So I'll follow up on that with my colleague Myrta. I know she's only just sort of starting work on that at the moment, and get a bit more detail of what Bristol have done and how they've gone about that as well.
Thank you. There's buses as well, I suspect. There's two large bus companies. We could twist their arms. But it'll be commercial decisions in the end, I suspect, that private companies will be interested in. Thank you, everybody.
Right. Councillor Thompson, then Councillor Tudor.
Thank you, Chair. Just very aware that we host some pretty large gambling organisations in the city, and wondering what work is being done with them as major employers, but also sources of potential problem. Thank you.
Who wants to take that one? Okay, Grace.
I'll have a go, Councillor. So I suppose the honest answer is not enough, I'd say, at the moment. So I'm undertaking some work with the Anchor network, the network of major employers in the city. And we've got a specific group that focuses on sort of financial inclusion, cost of living, in which we do talk about gambling harms and encourage those partners to take on training. But obviously we've got the likes of Sky Bet and others based down near the canal, and they're not on those groups, but I believe are represented in the wider network. And I think, there is more that we could do. And they're obviously they're national organisations, but based in Leeds. But it would be an interesting one to take away. But I think through the Anchor network, I'll look into what more we could do to ensure that those organisations are represented in the groups where we are already discussing gambling harm. One example of a piece of work we're doing with employers or looking to do with employers across the city is to roll out some HR guidance that we've started at Leeds City Council, and it's around supporting employees who might disclose that they've got gambling related harms, either that they're directly experiencing or that someone like an affected other, we use the term affected other, so someone close to the person who gambles who might also be experiencing some level of harm. And we think it's really important to get that rolled out across organisations in Leeds. So I think that will be one practical action we can take away and try to widen that piece of work.
Yeah. On that point, well, I think bearing in mind what's been said today, I'd like Becky, me, and maybe Councillor Harland and any other officer that needs to come together and think, how can we, because Scrutiny have raised some very important issues today. Now, is it up to Exec Board to say something, to task our Economic Services Unit to go and do something? Is it up to us to say to Councillor Trustwell's Scrutiny Board, you need to look into this, so that we can decide the best route to do it, rather than a scattergun approach, that it's one that we can agree, or is it down to the licensing chair to take this forward? I don't know at this stage, but I am concerned that members are making very, very valid points, and I certainly don't know the correct route that we should be following. So we can't make decisions as a board today anyway. So if we can get Becky before we next meet to try and come up with something that we can approve at our next public meeting, to take it forward, and trust us. I know, trust me, I'm a politician. That's something that a lot of people have difficulty with, but I think it's the best way of moving this one forward. So, Councillor Thompson, do you want to come back in again on what you've heard or add anything?
Sorry, not particularly that was helpful, but it would be good to see how we can take that forward. And if I can help in any way, I'd be more than happy to do so.
Yeah.
Thank you.
Matt, do you want to come in?
Yeah, I think I'd just say that the industry operators these days, most of them have now consolidated and merged into very huge international global operators with enormous power. And of course, they're private businesses whose goal is to keep the shareholders happy and make as much money as possible. So when we're considering engaging with the industry, I would just have a small spoonful of caution to that, in terms of the industry tend to get a lot of public relations from attempts to engage with them in areas that we might wish to do so without taking the necessary action that we'd like to see. The best action we can take is where we have got powers to take preventative action, curtail the availability of normalisation, look at the advertising as we've just discussed, look at more consistent public health messaging across the city. I think we had quite a good Beat the Odds campaign that Sue referred to. Manchester is doing, I think, some more significant work on public health messaging, for example, social media and physical premises. So I would just have a little bit of caution in terms of engaging these huge operators when we've seen evidence time and time again of not taking the action that's necessary.
That's fine. That's fine. Right, Councillor Tudor.
Hi. When I read the report this morning, the thing that worried me most in the document was the paragraph about youth gambling. 24% of secondary pupils reported they had gambled within the last 12 months. Skin betting was highlighted as the most popular type of gambling in this age group, 11 to 16. That was a thing that I would be interesting to find out. For example, the document talks about the Leeds Gambling Harms Group, a network of key partners that delivers projects. So it'd be interesting to hear more about the details of those projects, and to get ward level data about the demand for gambling treatment services.
Sue, can you take that one, or is it Grace or Grace?
Yeah, probably me. Sorry, you'll be sick of me. So on the children's gambling work, we have a specific officer, Emma Newton, who's based in the public health team, who has a focus on gambling in children. And the statistic that you read, Councillor Tudor, is came from our My Health, My Schools survey in Leeds, which we introduced a number of questions specifically relating to gambling, and it's one of the best sources of information we have around like the level of gambling harm experienced by children in Leeds, and I think it's something that's unique to Leeds as well, and it's shocking, and we have a specific work programme that focuses on children that our colleague Emma leads, and that focuses on communications and training. So one example of some of the training work that's being done is Emma has worked with a number of sort of PSHE leads across Leeds sort of secondary schools, and been working with them to understand sort of what their gaps in knowledge are, and what are the needs of the young people in their schools, and we're working with Gambling with Lives, who are a charity that do a number of things, but deliver training and education packages around gambling related harm. They are creating a bespoke package for these PSHE sort of leads, and we're going to be launching that in February on a pilot basis, and it's actually part of a regional piece of work as well. It's something that we're doing with the Yorkshire and Humber sort of regional public health leads network with a focus on gambling, and so it's quite an exciting piece of work that we're launching in Leeds, and Bradford Council are also going to be launching, but there are also many other areas of work. So within our communications campaigns, for example, the Beat the Odds campaign, we have a children's focused section kind of always within that, and actually last year, I think it was we ran it, was it November last year, the messages that went out to sort of parents in particular were the most viewed posts, so we were having tens of thousands of engagements and posts, and they were really, really successful. And we work with a number of kind of national organisations, like our colleague Myrta Elba organised a session with the National Centre for Gaming Disorders, for, I think it was for a number of kind of officers either working in public health or adult children's social care, where they could receive specific training on things like skin betting, because actually the regulation around, and Matt maybe will be able to answer this probably better than me, but the regulation around gaming is definitely a bit of a challenge. I don't think skin betting is illegal in this country, whereas it is in the Netherlands, and it is an early introduction to gambling at a very young age for children, and is becoming normalised as part of gaming. And I think there was another question, but I know there was a question about the ward level data as well. So I think that's probably one for Matt on the Northern Gambling Service side, but it's something I could take away for the Leeds Community Gambling Service to see if they could provide that. I think that answers the question.
Councillor Tudor, do you want to come back in again?
No, that's brilliant. Thank you.
Good, thank you. Right, anybody get any other questions before I move to the next stage? Right, I've got one question. How do I, who's relatively ignorant in this, how do I know the hidden issues in my ward, how would I recognise, and I'm not asking necessarily to have a seminar on it today, but should we run a seminar to try and help elected members identify potential people in our communities that might be having these issues, and what more can we do? So how do we address the hidden issues? Because in my ward, you might find that it's not explicit, but behind the doors, you don't know what people are doing, because as Councillor Leigh said, a lot of it's going online nowadays, and I've no children, but it's bad enough some parents trying to control what their children do or do not access. So how do I, as an ignorant person, get to understand the hidden issues we've got here? Anybody like to proffer an idea as to how I can improve my education? Apart from go back to school. Sue?
I don't want to step on Matt's toes at all here. I don't think anybody expects you to, Councillor Anderson. We work with a number of organisations like Citizens Advice and debt agencies, and they struggle to identify people that are. It's a very secretive, hidden issue for many people because of the stigma and the shame that they feel around being addicted to gambling. Yeah. So no, nobody's expecting you to identify it when you're speaking to somebody in your surgeries. We do have, we talked a little bit about the community gambling service. They do have some posters that you could put up in your surgeries, which provide a QR code that people can self-refer into for that initial brief assistance, like on quite a low level. And then obviously Matt's got his hand up, so I'll hand over to Matt, but we can certainly provide some material for you to keep in your surgery, but no, nobody's expecting you to identify somebody.
That's fine, that's fine. Now, before bringing Matt in, just to give Nicola and Councillor Harland due notice, what I'm going to come to you if you want to say anything final in terms of summing up. So to give you, so I don't want to just drop you in it and say, in 2 seconds time, you've got to say something. So I'm going to be coming to both of you to ask if there's anything you want to say based on what you've heard today, or any comments you want to make about the gambling things in general. So I'll take Matt first, and then I'll come back to one of the two of you to bring this session to a conclusion. So Matt.
Yeah, I was going to just largely agree with what Sue was saying. It's a particularly hidden problem. If we think of drug and alcohol problems, they're much more likely to manifest themselves to other people, and they're much more obvious with physical signs, for example. This is very hidden. Our service users are able over many, many years to keep their very significant gambling problems from their loved ones and from their closest loved ones. And it can be a shock to the family system when that is discovered. And it can also be a risk, and it's a suicide risk as well. Those that hold the data are the industry, of course. They track every transaction and they can see what's happening. Unfortunately, they're not taking the action that we'd like to see. They take action when somebody wins. So they're much more likely to make it difficult for you to withdraw your winnings or to even close or restrict your account. But if you're a losing customer, you're much more likely to receive nudges, notifications, rewards, advertising, and so on. So we've got a very concerning business model for the industry that needs to be tackled. So the hidden nature of it is very, very difficult. We have to come at it from the advertising, restrict the availability and the acceptability. You were talking about young people. When I was growing up, it wasn't really on the radar of me. As a teenager, when I became 18, my peer group wasn't interested then, thinking, right, now I can go to the bookmakers. But I can tell you now, when children are getting to the age of 18, that's the one thing that they tend to want to do as a milestone in life now. It's gambling rather than smoking or drinking, other activities. It's gambling. So it's the shaping of their attitudes during the teenage years that we need to tackle through the advertising and normalisation and the embeddedness in sports.
That's fine, thank you. Right, so if I can go to Nicola first, is there anything you want to add in terms of what you've heard, or anything that your professional experience has taught you that you would like to bring to the attention of the members?
No, Chair, Sue more or less summed it all up from our side, and licensing, as she explained, were just the bricks and mortar of the premises. But over recent years, we do get very engaged with local communities and representatives when we do receive applications to try and make a difference. As explained, it's permissive. They're generally granted. They do generally receive representations that do come before a licensing subcommittee. But our hands are tied with it being such a permissive regime. So to refuse an application is a very prolonged process. And whether we'll be successful at the end of it all, that's a different matter. So we try and work with applicants to make the best of what we can. I suppose, as we've maybe had future discussions and decide where we want to go with things, we do have contacts at the Gambling Commission, so it might be wise to put it back on them and say, look, we've considered your questions, this is what we'd like to do, but what are you going to do to help us?
Yep,
put it back on the Gambling Commission.
Thank you. Right, Councillor Harland, do you want to just provide a summary from your perspective?
Well, excuse me, I'm losing my voice today. This is a subject that's concerned me since my licensing days when I chaired the licensing committee. And I remember us lobbying against the fixed odds betting terminals. And Sue's right, and Nicola and everybody, we're very limited in what, as a licensing authority, we can do. However, we can lobby, and I think we should lobby. I'm like you though, Barry, where it sits. Whose responsibility, but I think it's probably the responsibility of all of us to tackle this. But also, as Matt and Grace and everybody else has said, this is a hidden addiction, and it's not seen. Joe Public doesn't see, or the majority don't see that it's an addiction. It's very difficult to recognise. As Matt just said, when somebody's had a drink, or they're hiding drink, or there's physical signs that you can see. This is a little bit more insidious, I think, and secretive. It's a shocking thing. I have personal experience of it, and my friend's son, from being very young, was, and it's not about the winning the money, it's the gambling that's the addiction. It's not the winnings, it's the buzz of the gamble. So I'm happy to do anything that we can do to tackle this, because it is, you see these horror stories of people that take their own lives because there's no other, they don't see any other avenue. But thankfully, Leeds is on the forefront, and we do have people like, Grace and Matt, and the working partnerships that we've got. So we're lucky that we are on a bit of a front foot of the recognition of it, and but happy to do anything that we can. But if it's one of us, all of us, whatever, but happy to be involved.
Yeah, thank you. And it has been unfortunate that Myrta isn't here today. I mean, I have benefited from getting a briefing from her in advance, and her knowledge and enthusiasm came across when she was briefing me, and it's a pity she's not been here today, but that's circumstances. So, Becky, where do we go from here?
Councillor Anderson, I just noticed Councillor Akhtar's hand up. I don't know if you want to take Councillor Akhtar before me.
Sorry, Councillor Akhtar. Yeah, Councillor Akhtar.
Chair, I listened to this particular debate with a great interest. But one thing which I feel which was missing, especially when we talked about the teenagers and the trend where it's becoming a new culture, what work have we done within the schools at the early days of their life to prevent them going for gambling, because the effects and knock-on effects not only on them but also on their families and their within their own society. So I just wanted to see if we have done any work within primary or secondary schools in the city.
Well, Grace, you seem to have taken every other hospital pass in rugby parlance today, so here's another one for you.
Yeah, absolutely. Thanks, Councillor Anderson. Yeah, so it's a brilliant question. As I mentioned, the My Health, My School survey is how we kind of monitor and build an evidence base for that. And what we've done is focused on secondary schools because that's where there was most prevalence of gambling. But I think there are 2 age groups, if I remember rightly, it's years 5 and 6 who also have the My Health, My School survey, but there was much less prevalence. But having said that, we have organised a number of training sessions that have been offered to school staff, also including primary schools, but also with children's social care staff who are out on the front line with young people that are obviously, may have the opportunity to observe where a young person's gambling or gaming might be becoming an issue. So that tends to be our area of focus. And also through the communications campaigns, as I mentioned, where in the past we've been able to target our engagement work, our social media messaging to specific age groups as well, which is something we could look to do more of.
Well, do you want to come back again, Councillor Akhtar?
No, I'm fine with that, Chair. As long as we have done some work and we have something in plan for the future, and that's important to keep these kids away from the gambling.
That's fine. Becky, I don't know if you noticed that Councillor Tudor put in the chat the connection to Bristol, so I think that's an important one. So how are we taking it forward from here, Becky?
I think, Chair, in the first instance, it would be helpful to work with particularly the Leeds City Council officers who are online today to put together some sort of statement you can formalise to a constituted meeting, so that's a matter of public record, and we'll see if we can set out some next steps in that can be formally endorsed by the board.
Yeah, that's good. And also, I'm not trying to pretend that we've had probably hundreds of people watching us online today, but I think if we could get some social messaging that if you know of anyone who is suffering from gambling, you can listen to the debate and the quality of the debate that has taken place today, and how active Leeds members are in wanting to get something done about it as well. Because if they haven't had a chance to see it today, I do think if someone was to watch this hour meeting, they would be able to get a lot out of it and see the care that the councillors in Leeds City Council feel about gambling and trying to do something about it. So it's just a way of trying to get the message out there, because I'm not pretending that we've got a lot of people on this call just now. So with that said, can I thank Matt as an external guest for coming along? The other officers are present, it's part of their job, so they have to attend and be grilled by members. But can I also thank all the members for taking the time to come here today, and also Councillor Marshall Katung, who chairs the Health Scrutiny Board, and hopefully she's picked up some things that she can take back to her board so they can decide whether or not they want to look further into any of the issues that have been raised. But thank you all for coming along, and have a good weekend. Bye.
Thanks, Barry. Bye, everybody.
Thank you.
Thank you. Bye.